We talk about wanting to have balance in life. We talk about it with training as well from day one of med school, but learners have to realize that learning ends at some point, at least the formal part of it, and you want to be able to have a job, you want to be able to have a life, to have that balance. And practically, it's very difficult to do that in a city where you're not sure who you have to apply to, the jobs that you actually have to go to, the places, the departments. And on top of that, you have to add in the very practical things of driving to all these different places, having a house somewhere else. And you get to experience what that balance is by doing UCLIC and being in a rural area. And there are always going to be jobs there for you. Can't say that in the cities.
I think it doesn't matter what specialty you want to go into. If you want to learn how to be a really outstanding physician, getting trained in a rural environment is the best place for that, because you will learn to be with people at every stage of their life, and you'll learn how to think on your feet, and you'll be given a ton of independence and responsibility that you wouldn't get in an urban environment because there's so many other learners.
So students coming to a longitudinal clerkship perform very well. They often exit clerkship being, stronger than their counterparts in the city. They're working often at the level of a first-year resident when they leave, and they're really well prepared for any residency, whether it's family medicine, rural family medicine, or even a specialty.
The difference between a UCLIC student and one in particular that I'm thinking about now, the last one that I had, she was above resident level when she was done with her UCLIC year. She was more competent, more independent, practicing self-diagnosing, self-thinking, managing patients on her own, better than most residents that I've had. And that says a lot. I would say she was functioning at second-year residency level easy.
Without a doubt, doing a rural clerkship, a rural residency gets you better references. You work with a primary physician or preceptor for a longer period of time. They know you better. You get to develop greater acuity technical skills that they can comment on. They can use specific examples from your training. When you do a urban rotation, there's so many learners. The time is so limited with each preceptor. The references may be good, but they're often more generalized, and therefore they don't go as far as a reference that comes from someone who can say, on this day, this happened, and the student was able to do this, and this is why this is important. Those specific examples carry way more weight in the long run for matching for residency programs, matching for fellowships, and getting a job.
You can tailor your experience to your interests within reason, as long as you're meeting all the requirements. If you have a special interest in something, we can help you find more exposure to that. If you're struggling in a certain area, we can help work with you and figure it out. You're not jumping from a rotation to a rotation. Those relationships that you build, both in terms of your career going forward, but also in terms of how you learn during the rotation, you can't beat that, and you can't replicate that in the rotational system that's done elsewhere.
There's the assumption that rural family physicians make less money than their urban counterparts. That is not true. In fact, we make more than we would in an urban city because we're not just family physicians, we are general practitioners. The scope of our practice is more intense, more demanding, more challenging, and therefore we're compensated accordingly.
In regards to specialties in itself, I've honestly settled in to say I want to do rural family medicine. It's great out here and it shows how amazing the program is. But I have some peers in UCLIC right now who are going for more competitive specialties, who have had no concerns, who have been able to get preceptor kind of reference letters pretty easily here, who have been able to get electives. And I think when it comes to UCLIC or any program, truly, you're going to get out what you put in. So if you're coming in even knowing that you want to do surgery, for example, and you get here and you force yourself to go to the operating room as often as possible, you force yourself to see as many procedures as possible, well, you're going to have that for your application regardless, right? So even if you're kind of on the fence, I think it's warranted to take a look at UCLIC and see that you have a lot of chance to direct your learning, and that might work out for a better outcome.
The UCLIC preceptors, the people who work with our program, are among the most dedicated rural educators that are out there. And that shines through in the experience. And so the UCLIC experience is a special experience for people. It's an amazing learning experience, it's an amazing medical experience, but it's often an amazing personal experience too. It's a way that people get a little bit outside of their comfort zone, they find themselves, they find their own feet, and they find that actually I'm okay and I can do this. And they head into residency as competent, confident doctors who are able to take on the challenge of learning at the next level.